A new call tonight to strengthen state laws surrounding nursing home staffing.
Since last month, WRAL Investigates has been reporting on issues at Carver Living Center in Durham, including video we showed you just last night, which captured an assault inside the facility.
WRAL's Sarah Kruger is asking lawmakers what they will do to change things.
One common concern I heard from families is about staffing or a lack of staffing at this facility. State lawmakers, they have the power to set a nurse to patient ratio and to dictate exactly how many hours each nurse needs to spend with each patient. So I'm asking, will they?
The family of Leon Garrett, who died this summer, remembers him like this, a chef with a contagious laugh. That was before a series of strokes took away his independence and led him to live full-time at Carver Living Center in Durham for nearly 5 years.
His story is going to be told so that no family has to go through what we have endured.
He needed help with everything, but they say he didn't get that help at Carver, even on basic needs like assistance with eating and drinking.
That facility took advantage of that, and they left him alone.
You don't hope for people to lose their jobs, but ultimately that facility needs to be shut down.
A big problem, they say, not enough nurses were on site.
Like when you go in, it's a ghost town.
Medicare.gov shows the time residents at Carver get with nurses is worse than the national average, and the turnover of staff is much worse.
North Carolina should not be proud of our standing.
Bill Lamb serves on the senior Tar Heel legislature, a group that lobbies the General Assembly on issues related to senior citizens. For 2025, one of their top priorities is asking the legislature to pass a law that dictates a certain number of hours staff needs to spend per patient in assisted living facilities.
Why do you think it's important that there is some kind of a standard for patient to staff ratio?
The quality of care in nursing homes is a direct result of the quantity, quality, and stability of the direct care workforce.
Lamb explained new federal rules just went into effect this summer, requiring residents get about 3.5 hours a day with nursing staff. He says some states have their own laws that go above the federal minimum, but North Carolina does not.
Do you think North Carolina needs a lower nurse to patient ratio, and will you push for that?
I haven't looked at the patient ratio in a while. I will look at it. If you lower the ratios, we'll add to the cost. And right now is a tough time to get more federal money, more state money.
Representative Donnie Lambeth serves on the legislature's health committee. He believes the problem traces back to money.
We were able to put a significant amount of COVID money in during the COVID period in terms of like bonuses that helped a lot with retention, but that money's all been spent and gone away.
He commits to looking into the issue.
I think it's time for us to step up and do a little bit more investigations and get some data and determine if we need to make some changes in that industry.
Sarah Kruger, WRAL News, Durham.
We were able to tell this story because someone reached out to us and asked us to look into it. If you have a story that needs an investigation, send an email to investigates@wral.com.